So next topic is impact of zoonosis. Impact on human health, impact on animal health. That ultimately lead to impact on the economy. Economy, that is the related with the source of income, that is foreign exchange. For example, export of animal products like milk, meat, egg, wool, leather. The export of these animal product that led to contribute to economy. Then tourism and travel also contribute to economy of the country. So animal health as well as animal production, that is product, animal product, these are very important because they contribute to the Indian economy. So in this lecture we'll see what is the impact of different zoonoses on human health and on animal health, which ultimately led to the impact on economy of the India. Socio-economic losses from the zoonosis or zoonotic diseases. These socio-economic losses, they are difficult or hard to quantify completely. The reason is because the cost of life and the suffering cannot be measured. But these socio-economic losses, they can be assessed by some parameters like morbidity, mortality, disease incidence and disease prevalence. These are some of the examples, or these are some of the important MCQs. Rabies, morbidity and these values are per year in India. So in case of rabies, there are 30,000 deaths per year. In case of tuberculosis, 5 lakh deaths per year, and new cases, that is incidence, 22 lakh per year. Japanese encephalitis, 3,000 to 6,000 cases per year. Hydatidosis, 6,000 cases per year, and tetanus, that is neonatal, 1313 cases per year. मैं अभी बोलूँगा तब फिर से दिखा. So these are the diseases and these are the parameters which can be assessed to assess the socio-economic losses. So in case of rabies, 30,000 deaths per year in India. In case of tuberculosis, 5 lakh deaths per year, and new cases, that is 22 lakh. Japanese encephalitis, 3 to 6,000 cases, and hydatidosis, 6,000 cases per year, and human, that is tetanus neonatal, 1313 cases per year. So these are the socio-economic losses because of the zoonosis, which can be measured with the parameters this. Economic losses or financial losses that happen because of zoonotic diseases in animal or in human population. Number 1, in case of animal, because of this zoonotic diseases or zoonosis, animal illness and mortality. In human also there is serious illness and mortality takes place. In case of animal illness, there is reduced or loss of efficiency of the draught animals. So what are the effect of animal illness? There is reduced or loss of work output, that is efficiency of the draught animals. And the effects of this serious illness, febrile illness or human being is here loss of efficiency of animal, here loss of efficiency of man in the form of man hours and labor productivity. Second is loss of earning, malnutrition, clinical complications and interference within the family life. So these are some of the losses that are related with the febrile illness in human, and these are some of the losses with animal illness. Then treatment of sick animal, that is medical cost. Similarly in human also, treatment of sick person, that is medical cost. Then there are expenses on surveillance mechanism. These are different surveillance mechanism, and these are the expenses which lead to financial economical losses. Number 1, expenses on diagnosis of animal diseases, detection of the animal reservoir, isolation or quarantine of the infected animals, inspection of meat, milk, and after infection their condemnation. Then expenses on the treatment of animal and immunization or vaccination programs. Then restriction on tourism. This restriction or ban on tourism, one example is there from 94, that is outbreak of human plague. During this 94 human plague outbreak, there was restriction or ban on the travel or tourism that led to 900 crores financial loss. The recent example on tourism is your COVID-19. That is, the ban on restriction on travel and tourism also led to this financial or economical loss because of the zoonoses. Next, import and export. Due to impairment of the animal production or due to animal mortality, animal illness, sickness, or productivity loss, there is loss of foreign exchange with import of the animal products like milk, meat, egg, and leather. So import of these product led to drain of the foreign exchange that can be utilized for the development of economy, but that is lost because of the loss of our animal productivity because of the animal illness from the zoonoses. Next is export. Export of animals and animal product. Because of these zoonotic diseases, there is ban or restriction on this export of the product from the country where zoonosis disease are more prevalent. So that also led to loss, economical loss. So these are the economical loss from the livestock sector, and these are from the human lives. And in case of human being, those who are immunocompromised, whose immune system is weak, and if they are suffering with those diseases which cause immunosuppression like HIV/AIDS, they are more susceptible to infections like bovine tuberculosis, cryptosporidiosis, and that becomes more fatal in case of immunosuppressant human being. So these are the economical losses from animal side and from the human side. Number 2 is undermine animal health and productivity. So because of this zoonosis or zoonotic diseases, there is loss of animal protein in the form of milk, meat, egg, etc. Then impact on human health. The impact on human health is mainly in the form of malnutrition, and this malnutrition is because of the less or reduced supply of protein of animal origin. Protein of animal origin, that is in the form of milk, meat, or egg. So impairment of the productivity led to loss of the animal protein, and less supply of this animal protein lead to human malnutrition. So these are interconnected. So first we have discussed socio-economical losses from zoonosis, that with some parameters like incidence, prevalence, and morbidity, mortality. Then economical or financial losses from animal or human side. Then impairment of this animal health and productivity that lead to loss of animal protein, and this loss of animal protein lead to less supply of this protein to the human, and that impact on human will be malnutrition. So main factors for the spread or perpetuation of zoonosis in India. So these are the 5 important factors, 5 important forces which are responsible for the maintenance of this zoonosis in India. First is the consumption of unpasteurized milk and other dairy product. So without pasteurization, milk consumption. Next, large population of the stray dogs that are responsible for the rabies. Then illegal slaughtering and inappropriate waste disposal and illegal trade of the animals and their product, mainly illegal trade of the wildlife products. Close association between the human and animal population. So these are the forces, factors responsible for the perpetuation of zoonosis in India.